Well, thanks for looking up information about disordered eating, body image. You're wondering probably, do I have an eating disorder? Or possibly some of the symptoms you're noticing might be the onset of an eating disorder. I like to refer to it sometimes as disordered eating or differently ordered eating patterns, but it also affects fitness or social relationships. So think about maybe assessing yourself. The prize for working through this type of an issue is healthier body, obviously, healthier mind, spirit, as well as relationships around you can improve as we improve our health and our thinking about ourselves. Oftentimes you'll notice an increase, possibly you've noticed an increase in negative evaluation about your body, negative evaluations about you as a person. It's important to remember you're not the problem is the problem, and to put that firmly in its place, that if it's a disordered eating pattern, that you're not the problem. That way it's easier to tackle that problem. So for thinking patterns, you might start to see increasing thoughts, maybe 10, 20, 30, 50 times a day, negative thoughts about yourself. You might also see behaviorally then, or mood swings, but behaviorally you'll see maybe restricting food or binging. You might even start considering whether you would purge or throw up. A lot of people have done that. Doesn't mean you have a full-blown eating disorder. However, that would be a pretty big red flag that you might be on the verge of developing one that could be diagnosed. If you haven't yet been diagnosed, that's quite common as well, because a lot of people are secretive about this type of problem, holding it in, don't want to tell friends even, family members, parents, even spouses, depending on your age and your situation in life. So think about assessing your behaviors like you're curious, like a curious observer. Oftentimes when you start to hear that negative voice or stinking thinking tell you, I'm not good enough, or I've got to have some kind of more control in my life, or my body's not just the way I want it. Oftentimes your mood starts to come down, feeling sad, feeling more dysphoric or flat affect, maybe slightly depressed. And you could have anger outbursts or even some anxiety around, oh no, what about this, what about that? So those are normal feelings that'll start to increase when anger and anxiety and sadness start to feel excessive. That's a good sign. Think of it like your emotional guidance system telling you something's not right. So those are the moods, and then the behaviors, of course. You might start wearing baggier clothes. You might start not telling people what you're eating, when you're eating, start to be more secretive and hiding, deceptive, even amongst friends, family members. You might actually feel inside your head and body that you are sneaking around and taking more food or less food. Or possibly even your fitness routines start to become excessive. Those are some good clues that you're starting to feel the onset of some body image and disordered eating patterns, which they're very common. Especially through adolescence, it can be very common for people to think about these things as friendships don't seem to go well, or difficulties in life happen, whether it's trauma, traumatic injury, loss of a loved one. Oftentimes when we experience these challenging events, our mind and body can respond with something that seems to be unrelated. It can actually be a coping mechanism. The undereating, overeating, body image focus can be a coping mechanism to take our mind away from whatever else has gone on or other problems. So think about that as far as assessing yourself, but from a curious approach. People often become more serious and gradually more and more concerned and worried. So I'm asking you to consider looking at yourself in a more of a curious way. What are my thoughts? What are some of the stinking thinking? And they're not even our thoughts, most of them. Think about just the thoughts in your head like data, and then you can analyze it a little easier. You can even check the frequency, jot down how often is this thought happening, how often is this behavior happening, and you can monitor it over 3 weeks, 4 weeks, a month to see. Generally, when we start to monitor it, we can actually bring those concerns down. Of course, when it's a full-blown eating disorder, we usually don't think very clearly. It can really affect the nutritional restrictions, and over-exercise can often affect executive functioning or executive thinking. So it's really hard to act on your own behalf. It's very important to include family members if you think it's moving into a severe and actually an eating disorder, which you'd want to have diagnosed by your doctor. The signs you might actually be in a full-blown eating disorder would be now not just a lot of thoughts, it would be more like obsessive thinking. There could even be some physiological issues. Your hair could be thinning. You could have skin issues as well. Sometimes people lose even enamel on their teeth. Sleep issues, digestion issues, even GI or gastrointestinal issues. So think about all those start to become a problem. It could be getting closer to an eating disorder than disordered eating, which is not generally a higher risk. It is a very important issue to monitor because people can have heart issues and cardiovascular risk with eating disorders, which is why it'll be diagnosed and there'll be a more intensive program for healing and recovery. So if you're noticing signs that you might be on the road to having an eating disorder, then think about ways that you can open up to somebody you trust, somebody that you feel can really support your efforts forward. Think about who you could open up to, and definitely do that, because you can hear that negative voice, don't tell anyone, no one will ever know. People know, or they get a sense, but sometimes we just don't want to interrupt or ask somebody some difficult questions, even your parents or even family members, spouses. So think about you finding a way to send that message out that you have concerns, and that's a big step to take, to let someone know that you have concerns and to get the support that can really help you specifically come up with a plan to build those relationships up, address some of the tensions and stress that might be underlying disordered eating patterns. Also ways to shift thinking patterns. The thoughts in our head aren't ours, so we can select different ones. Sometimes you might want a coach to do that. A book that can help is Mind Over Mood or 7 Habits of Highly Effective Teens. Those are great books to start to think about building a better relationship with ourselves and other people. Also to manage some anxiety and depression qualities that can get in the way. What I'd like you to do right now is pause the video, grab a sheet of paper with a pen or some colored pens, and do this exercise. Draw a line right down the center of the page vertically. On one side, you're going to put down 3 things you really like about yourself. And on the other side, you're going to put how that likely would make you feel by dwelling on and thinking about those things. Oftentimes we want to rebalance the mind by focusing on more positive thoughts about ourself, our body. The other thing you can do is jot down 3 aspects of your body that you really do appreciate. And then again on the other column, jot down how that makes you feel. How it makes you feel when you think about the parts of your body that you are appreciating. This goes a long way to help you balance off the negative dwelling that generally starts to happen when we start down that road. Pause the video, take a couple of minutes, and do this exercise and see how it starts to make you feel inside. I want you to notice, even just doing a small exercise about your positive characteristics and things that you like doing, how that can shift the feeling, even if it is only for a few minutes right now. And then come back. It might not seem like much. However, notice how it made you feel, just to look at some of the positives. Even notice, what I want you to also notice is, how did the thoughts get in the way? Perhaps there were thoughts popping up, getting in the way, like this won't work, this is no good. Excellent. Those are the types of stinking thinking, negative thoughts that can block us from getting health and wellness in our lives. There are also the thoughts that can lead us to very unhealthy choices. So now that you've done that exercise, notice how important it is to balance off thinking the negative thoughts with some positive thoughts about your life, what you've done, what your characteristics are, what your body has to offer you, reach out for help. We don't do very much on our own, really. And the thoughts in our head aren't ours. So a lot of the confusion and struggle that you're experiencing didn't even come from us. It came from events, situations that we've experienced over the history, however old you are. And those get in the way of our growth and development many, many times throughout our lives. So getting assistance and support to work with somebody, possibly a therapist, can really help. There's also a few books. One's called Life Without Ed, or Life Without Eating Disorder. And if it's not a full-blown eating disorder, we turn it around to Life Without D, or Disordered Eating Patterns. Most people have differently ordered eating patterns. Continue to assess yourself. Watch for the risks. Watch for the increase of negative thoughts, the increase of body shift changes and attitudes about the body, attitudes about your own hope and opportunity on planet Earth. So if you're not ready to do anything just yet, continue to monitor yourself. That's a good step. Monitor your behavior, your thoughts, monitor some of the symptoms that we've talked about as they may or may not subside or start to grow. Monitor the direction that you feel your health is headed in. If it's headed in an improved direction, excellent. If it's not, if it's decreasing, increased negative thoughts, negative views of self, withdrawal, isolating from friends and family, then it's very important to reach out for help. And if you don't feel you can connect to friends or family, then definitely give us a call or give somebody a call that has some experience with this issue. There are many things you can do to improve, many things all of us can do to improve our heart, our mind, our physical body, and it generally just requires us to reach out. One of the hardest things to do when that negative voice is telling us we're not good enough or nothing will work. Both are lies. You're an amazing human from birth to death, and we've got to deal with behaviors, challenges, struggles in life. Get help. Thanks for watching. Take care out there.